The unprecedented COVID-19 pandemic has affected the entire world horrendously. It has faltered health systems, triggered social turmoil, and led to severe economic catastrophe. To combat this pandemic, under the able guidance of Honorable Prime Minister of India, Shri Narendra Bhai Modi, the Government of India has taken swift actions and put stringent measures in the country.
देश आज एक महत्वपूर्ण निर्णय करने जा रहा है। आज रात 12 बजे से संपूर्ण देश में संपूर्ण लॉकडाउन होने जा रहा है।
To deal with this predicament in the state, the government of Gujarat, under the decisive leadership of the Honorable Chief Minister and Honorable Deputy Chief Minister and Health Minister, swung into action. With responsive system and dynamic approach, the test positivity rate has remarkably reduced to 2.5% in December 2020, which was as high as 10.6% in June 2020. The case fatality rate has also drastically dropped to 1.76% from 7.7% in the month of May 2020. The apprehension that COVID-19 pandemic may continue or other similar pandemic may occur in future, it becomes imperative to review and document the ongoing response efforts at a state level. The World Health Organization recommended documentation of COVID-19 response. The Indian Institute of Public Health Gandhinagar, in collaboration with the Indian Institute of Management Ahmedabad and the World Health Organization, documented the actions undertaken by the government of Gujarat. This exercise is the first of its kind in the country, and it is based on the World Health Organization's 10 pillars. This video presents pandemic management strategy, the major challenges faced, success stories, and the best practices employed in COVID-19 management in the state of Gujarat of India. Planning, coordination, and monitoring are essential resources to handle any emergencies.
You have to be flexible in your decision-making process and strategy. From day one, we have been receiving constant guidance from Government of India. Regular video conferences with Cabinet Secretary had started, wherein Cabinet Secretary was talking to all the Chief Secretaries. Health Ministry there in Government of India was in constant touch with their counterparts in the state governments, and realizing that this is a challenging situation, the state government came out with a process wherein all decision-making authorities, beginning from Chief Minister, Health Minister, Home Minister, Chief Secretary, Finance Department, other line departments, their roles were carved out.
Pandemic with a lot of uncertainty. Daily, on a literally daily basis, we were learning, unlearning, relearning, and sometimes even U-turns had to be made in terms of what is the acceptable protocol, what are the theories, etc. So there were lots of changes which were being incorporated real time into it. And this also helped keep the political stakeholders and the feedback from the ground also completely plowed into the implementation.
We in Gujarat developed a system. The state government appointed 4 senior IS officers as nodal officers, dividing a state into 4 regions. And they had the mandate to see, on one hand, how to break the transmission of the virus. That includes surveillance, identification and enforcement of the containment zones, contact tracing, treatment. Thereafter, clinical management of the affected person. And that is how we could respond to the dynamic nature of the pandemic.
Gujarat shares its borders with Maharashtra, Madhya Pradesh and Rajasthan. Entries to the state by way of road, air and the sea were strictly controlled with great agility.
When we talk of the points of entry, we must appreciate that Gujarat has seaports as well as airports, 2 of them actually. So it was very important right from the beginning to put in place a mechanism, and we had got our teams doing the thermal scanning, and there were also senior officers deployed for this. There were help desks and a medical team available round the clock to ensure that passengers were being screened, and some of them who had symptoms were immediately being taken to the medical facilities. But along with this, We also had provisions for quarantine, and we had kept some of the hotels and such other facilities available right from the beginning to be able to accommodate such requests.
Surveillance, response and containment are foremost strategy to contain spread of COVID-19 outbreak.
So we started the Dhanvantri service. Now Dhanvantri service was not only an OPD clinic on wheels, but also it was a surveillance tool. We started Dhanvantri in almost every square kilometer of Ahmedabad city. We started distributing medicines, both prophylactic and also other types of medicines. And this became such a massive surveillance and OPD tool that eventually it was adopted as a model at the national level.
We also engaged the preventive social medicine departments of various medical colleges and converted these into RRTs, rapid response teams. And we also set up these epidemic intelligence units, which were in constant touch with the collectors and the officers there. They would go to the field.
We started house-to-house surveillance because at that point of time we were running in lockdown period and movement of people was not so free, and therefore there was a great opportunity to identify where the disease was prevailing. We enlisted large number of surveillance teams consisting of both health workers and teachers, and surveillance was so intensive that each household was covered weekly, and therefore we were able to not only identify the sick people, but we were also able to identify those people with high level of comorbidities, and that helped us in preventing eventual deaths.
Gujarat has taken prompt action to facilitate increase in laboratory capacity, hospital preparedness and infection prevention and control measures.
So all the districts were mandated to develop bed capacity of not less than 100 each in government as well as in the private sector, which the state achieved. And in larger centers like Ahmedabad, the requirement was much more. So on one hand, the identification of the right type of private hospitals started. And on the other hand, the government had decided to set up 1200 bedded dedicated COVID-19 hospital in the civil hospital premise of Ahmedabad.
Initially, we faced this challenge that we did not even have a single facility and had to send all these tests all the way to NIV Pune because the kits were not there. But way back in February, BJ Medical College started functioning, and then slowly we had to ramp up the quantity of labs, and we also had to rope in the private labs. So now today we have as many as 87 labs if we include the private and the government facilities, and we're able to test more than 27,000 RT-PCR samples per day.
In any public health emergencies, operational support and logistics are equally important.
See, the best practice was the transparent procurement system and integration with the upcoming demand. See, we could predict or forecast the upcoming demand very accurately and accordingly buy optimal quantity. We neither overpurchased or wasted money, nor we had to face any scarcity, and that too at a very reasonable price. Government's licensing with the industry has been at all-time high. So we worked both in tandem and ensured that people do not suffer, the patients do not suffer. And not only we supplied things in Gujarat, we also supplied outside Gujarat.
Literally, virtually, I can think of no instance where there was a gap of any of the consumables, kits, ventilators, and we also got tremendous support from Government of India, which was also giving us all these ventilators and other equipment.
In the pandemic, it is important that essential healthcare services such as non-communicable diseases and vaccination are not affected.
We maintain the continuity of the treatment for NCDs. We have taken a decision that they will be given medicines for 3 months, and then our field staff were supplying all these drugs, essential drugs, to these patients. And as soon as lockdown was withdrawn in those areas, then in all the non-containment zones, vaccination programs have been resumed.
COVID-19 risk communication and community engagement are very important for prevention and mitigation of the ill effects of the pandemic.
As you know, the first case of COVID was reported in Gujarat on 19th of March 2020. But before that, Health and Family Welfare Department, in coordination with Information Department, has already initiated a campaign by name of Namaste Gujarat. So the campaign focused on maintaining hand hygiene, maintaining social distancing, and doing Namaste rather than shaking hand while greeting. Honorable Chief Minister decided that during the day there will be 4 press conferences to educate, to disseminate information about COVID preparedness and how we are handling it. We launched a big campaign. Honorable Chief Minister, in fact, designed this campaign by name of Hu Pan Corona Warrior. That means I am also a Corona warrior.
So bringing in community into the task of proactive surveillance as well as COVID management helped in preventing conflicts between service provider and service taker.
In fact, we have been designing our IEC campaign on a weekly basis. 4 things were emphasized: frequent hand washing, then maintaining social distancing, protocols for coughing, no spit, and the government then came up with the guidelines that there will be fine on spitting in open. There are a lot of emphasis on maintaining calm during lockdown, what kind of activities can be undertaken by them.
Decisive leadership and able administration are key to effective pandemic management. Effective convergent efforts of various departments are imperative and should be sustained for future pandemic. Provide platform to exchange best practices and create a culture of learning and sharing. Motivate people to report positive cases, boost patients' morale under stressful conditions, and to strengthen confidence of people in efforts and measures undertaken by the government. Efforts on preventive action and health behavior such as hand wash need to be prolonged even beyond the pandemic. A standard clinical protocol with regular updation and proper training of the staff engaged in pandemic carries a lot of value. Active partnership and formal engagement with industries, academic institutions, hospitals, and civil society organizations should be leveraged during public health crisis and beyond. We are in solidarity with the country to fight against the COVID-19.
Hope for the best and be prepared for the worst.